Hello, I'm John McCurdy, and I want to apologize for joining you by video rather than being at the driver meeting. I always want to be able to take the opportunity of the driver meeting to um, sit down and talk with drivers, talk about the agency as a whole, and some of the things that are going on, kind of big picture, or SWITA. Um, this driver meeting is different. Of course it is. Everything's different right now. And so we're obviously trying to cut down on the number of interactions that we have uh, between staff, between drivers, etc. So I apologize for this video, but I'm also grateful that we are able to communicate in this way. I am going to go over a few things as far as kind of an agency overview. I am going to talk about some of the overall COVID impacts, a few things there. And I'm going to talk a little bit about Paraplan, the tablets, and just a few housekeeping things. Again, we all work for SWIPCO, Southwest Iowa Planning Council. That's the overall agency, and I am very fortunate to be able to be the director of not just SWIPCO, but SWITA as well. And I think sometimes in SWITA, we are in our own little world as far as public transit goes and don't always think about some of the other things that the agency does. And there's a lot. We work on all kinds of projects. We have a planning staff that works a lot with community development. That could be water or sewer projects, downtown renovations, flood recovery, of course, planning, working with cities, heck, even dog ordinances are included in some of the things that planning does. Our housing department, major impact in our region. Right now, they're working on buying out properties that were that were flooded out last year in the floods so that they can be demolished. They're working on housing rehab programs, renovating people's homes who need that. We have homeownership assistance programs. We even have a program right now where we're working with the Iowa Prison Industries with a prison in Newton to build homes that'll be for sale here in the very near future. A lot of things going on. We recently did our 5-year plan, and in going back through, SWIPCO has brought in $125 million in grants to Southwest Iowa in the last 5 years alone. And that's leveraged over $275 million of local private money. So it's a lot and we're all part of that. And it's a lot to be proud of. COVID, of course, has its impact on the SWIPCO side of things as well. Very few of our projects stopped. We continue to work on people's homes. Just because of a pandemic doesn't mean your roof stops leaking. Although that's probably a horrible example this year with this drive that's been. But we've continued to work on all manner of projects. And recently we received a $500,000 grant to provide 0% interest loans to businesses that were impacted or are impacted by COVID. We've also received $400,000 for our agency to work with the local economic development groups on COVID recovery. So there's a lot of things going on there that we're all a part of. On the SWIPCO side of the house, obviously, COVID has had a huge impact. I never would have imagined prior to March putting the brakes on everything, shutting everything down. And to go through that experience, I know it had to be horribly frustrating as a driver because things were changing all the time. I know we said things, communicated things at the beginning of March that were probably totally different at the end of March. I want to apologize for that. It has been very difficult to keep up with all of the guidance, all of the changes that have gone on. I think now we have a little bit better handle on things, and obviously, we're much more open, we're much more active, we're much more out in the public now than we were there for a period of time. I never in a million years would have imagined having to lay off drivers. Um, that that to me is one of the most insane things that has happened through this. We've been very fortunate because there has been CARES Act money that has come to our agency that allowed us to pay administrative leave when people weren't driving, and it's helped even out our operations. Our operations have come back much quicker than I would have anticipated. We're at probably 75% in a lot of our areas from where we were before, and which is, I think, outstanding, and also why we need to continue to have this training to continue to improve, because the pause button was hit, but it's back to play. A few things with COVID. Other people at this meeting are going to talk more about the nuts and bolts of like cleaning buses and procedures as far as, if you have a rider you think is sick, or if you need your vehicle sanitized, all those things. Other people are going to cover that. I want to talk a little bit about, of course, obviously your own health, and if you should think you may have COVID. It's already been here. If you don't know, we've already had drivers who have been positive with it. We've had riders who have been positive with it. We've had office staff who have been positive with it. Thankfully, we haven't had anyone with real severe effects of the virus, but it's definitely real and it's definitely here and something to be concerned about. If you think you have any of the symptoms, and we've all talked about them, fever, cough, there's a long list of symptoms, definitely let the office know. And they're 99.9% of the time going to say, talk to your doctor, talk to your local public health, line up and get a test. Initially, getting a test wasn't that easy. Now, there's lots of options to be able to get tested. Important thing to keep in mind is that if you test positive, we are going to, and it's a new federal benefit, which is nice, provide 14 days of paid leave. That doesn't count against your PTO. It's just 14 days. If you average, let's say you average 20 hours a week, you'd be paid at 20 hours a week. If you average 40 hours a week, 40 hours a week. The main point of that is we really want you, if you're sick, to stay home. And in our position where we touch the lives of all kinds of people for whom this disease is particularly impactful, elderly, disabled, we need you to stay home. The other aspect of this is if you've been in close contact with someone, which is defined as within 6 feet for more than 15 minutes, then you're going to be advised to quarantine for 14 days. And I think the hardest thing about that, and we've had staff who've had to do that, and drivers as well, is that no matter what, as far as testing goes, you could test negative 14 days in a row, but you need to quarantine for that 14 days. There's no testing out of quarantine. So keep that in mind. And also, too, do your best. We really have taken the stance as an agency that we want to encourage that social distance. Yes, wearing of masks is very important. And also, wearing a mask is also very important as far as the public perception of the safety of riding a SWIPCO vehicle. It's not just for your protection and their protection, it's also for peace of mind. But the best defense, not just the mask or, of course, hand washing, all those things that we're doing, is to try to keep that distance. And so that's why, in most cases, we've discontinued using minivans if we can, like the taxis are being done with buses, is to provide that extra space. We really do want to be able to say, if public health calls and says, well, was your driver within 6 feet for more than 15 minutes, that your answer could honestly be no. That's my goal there, is to prevent you getting sick from the disease, and then also preventing you from having to spend 14 days out quarantining. Again, if you are advised to quarantine by public health, you qualify for that sick time as well. So bottom line is, the main thing is taking care of yourself so that then you're available to help the public. The term essential worker, I think, has been a bit overused in these past few months, but really SWITA driver, our SWITA service is essential. When you think about, I talked about all the millions of dollars that SWIPCO brings into the region, but then you think about SWITA, that same 5 years, there's been about 1,700,000 rides on SWITA vehicles. And every one of those, 99.99% of those are essential. So we need to be there for our community. So again, COVID, sick leave, if you have any questions about it, call the office, talk to Doreen. Doreen Peterson is now the Human Resources Coordinator. That was Karen's position. Karen's also still here. She's our Administrative Services Director. Both of them are great resources. Feel free to talk to them if you have any questions. One last thing on COVID is also that we are continuing to pay the incentive pay. At the beginning, that was $5 an hour. We dropped that down to $2.50, partially because we have way more people back driving. Financially, to do a $5 an hour with that many people driving would have been difficult for the agency. The $2.50 is anticipated to last through the end of the year. And one thing too is to keep in mind is that is counted on when you're driving with passengers on. So things like this training, etc., where it's considered to be lower risk, that it doesn't get added on. But that is something that we'll evaluate at the end of the year here. Some other things of major importance. One of the biggest reasons we're having this training is the Paraplan software. A lot of you have been with the agency for a while. You used RouteMatch in the past, and now Paraplan. Our big rollout for Paraplan, if you'll remember, was March 7th. Well, March 17th is when everything hit the fan here. I didn't get to have a good St. Patrick's Day. A lot of people didn't. So a lot of people maybe got initial training, and then it's been a long time. And now with school routes back up, different things, we really want to take this opportunity to go through Paraplan. My biggest things that I want to stress is use it. Use Paraplan. If you don't use it, and by that I mean use the manifest, check people in, check people off, then we do not see the benefit from it. And the benefit as far as in dispatching and accounting and tracking of all the things that we have to track, with 300,000 plus rides a year, we need good accounting and tracking. If you don't use it, it's wasted. And also too, if you don't think it's right, let's say somebody's on your list, your manifest to ride, and you don't think that's correct, or vice versa, they're not on there and they say, yeah, I need a ride, I have an appointment or whatever, then call the office. They are more than happy to verify and check and put the person onto your tablet if that's correct, or if maybe it's a kid and they're confused and they don't ride that day, they can confirm that or call the parent to verify, whatever the case may be. So that's one of the big things we want to do today is work on Paraplan skills, and that's going to be ongoing. And if you're not getting it, that's fine. Talk to the staff. They will do whatever they can to continue to help you use Paraplan. So that's a major focus of today. A final thing I do want to remind folks, and I don't know how many times I can say it, but remind people to check your bus. It's a very difficult conversation to have with a parent or a guardian saying, well, we didn't know where your child or dependent was for a period of time, or we didn't drop them off where we said we would, but we checked them off on our list. So to the office, it looks like they've been dropped off. I bring this up because we've had a couple of incidents lately, and I know in every incident, in the driver's mind, everybody was off the bus. Well, I get that. I understand. But if you think your bus is empty, then take 30 seconds and walk to the back of the bus and check. I think in the past when we said, make sure when you're done with your route, walk your bus. And I think a lot of people do that. When they're done for the day, of course they're going to walk the bus, find the Hello Kitty backpack or whatever might have been left on the vehicle. But no, I think then that's led to some situations where, well, I'm done with this route and now I'm going to a different route, and I'm in a hurry, so I'm not gonna walk the bus. I'm just honest. I'm tired of having those conversations with parents. So there's a lot going on right now, and I hate to have that such a kind of a scolding, because that's not where any of us want to be. But I really can't stress that enough, and I want to take every opportunity that we can to remind folks to walk your bus. So I do hope, and again, I apologize for this video format. We hope to be able to be all back together sooner rather than later, but I hope that this training, that you find it useful. Ask questions, engage with the staff, because we really do want to come away from this with people with a better understanding of paraplan, have good conversations about what's going well, what's going poorly, and same way with our COVID response. We want to have a good conversation, find out, what are you seeing in the field? What are areas that we can improve on, and questions and concerns you might have. So again, thank you for taking this time out outside of your normal working time for this training. And again, thank you for everything you do. Without you drivers, without SWITA drivers, there is no SWITA service. And I can't stress that enough, that I do really appreciate the hard work that everyone does. And we want to make this an outstanding year. So again, thank you. And that's all for now. Bye.